Hello, my name's Grant Bentley and I've been a homeopath for more than 20 years. During that time, I've been principal of the Victorian College of Classical Homeopathy and I also run an online worldwide clinic. I've just decided to do a series of video blogs. How long the series will go for, I don't really know. It's just informal. Just every time I get a spare 5 or 10 minutes, I just wanted to put something out there. This is for who I'm trying to reach out to is for not only people who are studying homeopathy, but principally also for people who are trying to look into homeopathy as to what it actually is, because all we're getting at the moment is a lot of very negative opinion about how homeopathy shouldn't work and can't work and a whole range of other things. And one of the things that is most common, of course, to all of these anti-homeopathic statements is that they're all made by non-homeopaths and people that have never practiced, never really looked into it. And so what I'm going to do now is give you a very unashamedly biased opinion as to what homeopathy is by a homeopath. What I'd also like to do is just answer a few commonly asked questions, or at least some questions that patients have before they begin treatment, because every time, as we just stated, every time that they look up what homeopathy is, they always get a negative view. So what I want to do is just talk about how, look, when it comes to homeopathy, or when it comes to just people in general, you can divide the world into two groups. You've got the materialists, and then you've got people who like to think that there is a little bit more beyond the material. Now, what I mean by that is that from a material sense, if you're looking at, say, health and well-being, you view human beings and the body from, at least the body, from the carpentry and plumbing of the body, and the very fact of life. Life itself is viewed as a reactive process of, internal chemicals and nerves and so on to the external environment. But there are a lot of people out there that see life as just something a little bigger than that. And I guess this is where homeopathy also comes into this group too, that we see life as something a little bit more than just nuts and bolts. Now, what I mean by that is that one of the problems that science has with homeopathy is that homeopathy has in people, all people, the inclusion of what we call a vital force. Now, vital force is like an animating, you can't see it, but it's like an animating body, an ethereal body. It's a difference between somebody who's alive and somebody who's dead. It is a life force. You can, it's the Chinese system has it with qi, the Indian system has it with prana, homeopathy has it with vital force. And what we say is that when there's been a long-term disturbance in this vital force, a lot disease can form from there. And so we're looking at more than just the basic pathology when a patient comes into the clinic. We're not just looking at what they have, but we're also looking at why they had it, meaning the stresses that led up to and were a precursor to this then becoming a patient, and also to just their general vitality. There's a lot of things that people, when they're first beginning to think about homeopathy, they've got a number of questions, and I just want to go into a couple of those questions. One of the first questions, of course, is that do I have to give up conventional medicine, or do I have to stop going to a doctor if I go and see a homeopath? The basic and only answer to that is absolutely not. You do not have to stop any medication. In fact, I never tell any patients to go off their medication. And certainly, I would say the vast majority, in the 90% plus of all my patients, are also under the care of a doctor. So what homeopathy is really good for is, if medicine is seen as the treatment of disease, then homeopathy should be seen as a promotion of health. It's getting people back on track and getting their vitality back. once their vitality has been drained enough for pathology to begin. So the answer to the first question, though, is no, you do not have to give up any of the conventional medication, and no, you do not have to give up the care of your doctor. In fact, we encourage that you stay under the care of your doctor. The second question becomes that if I am going to remain under the care of the doctor and take conventional medicine, does that mean that homeopathic medicines won't work? And the answer to that is no, they will definitely work. What we're trying to do is different to what conventional medicine is doing. We are not trying to force the body to respond in any way. We are only trying to increase the vitality of a person, and their body knows how to regenerate and fix itself given the right energetic conditions. So the answer to do I have to give up medicine is no. Can we easily incorporate homeopathy into the conventional medicine regimen that you may be on? Is yes, that can be done. Homeopathy does not interact with conventional medicine. It can't because, I can remember just recently one patient saying that their doctor has said that they shouldn't be on any homeopathic remedies because while they're on a particular treatment plan, because the chemicals of one can interact with the chemicals of other. But there is no chemicals in homeopathy. I think that doctor was confusing that with herbal medicine. Herbal medicine, of course, has the chemicals of the herb itself, but in homeopathy it doesn't have these things. Now we'll go into the vital force and what homeopathics actually are and how homeopathics work during the series of these video blogs. But just now I just want to answer just a couple of the questions that people most commonly have, and they're the two. So the next question is, what does homeopathy treat? Well, essentially, homeopathy can treat anything. Anything that can be treated with a pill, homeopathy can do. Clearly, it can't do surgical techniques, but anything that can be treated with a medicine can be treated by homeopathics. You can divide the disease into essentially three groups. The three groups are trauma, which is when you hurt yourself, acute illness was when you get a contagious disease, and then there's another subgroup called what we call a non-infectious chronic disease, meaning that it's long-lasting, but it doesn't really have any infectious origin. And these include rheumatoid arthritis, migraines, depression, and so on. Now, they all have a non-infectious origin in the sense that, unlike, say, measles or chickenpox, there is no virus or bacteria that is the triggering event. As a result of that, what you also notice with people who have these sort of conditions is that there is a very strong energetic link. And how we know this is because most of the time people will say their condition, whatever it is much better if they get some rest, good food, good diet, and much worse if they're stressed or if they are deprived of sleep. So what we see there is that if we can keep the person's energy levels fairly stable, then that in turn works indirectly on the condition that they have. And this is where homeopathy comes into its own. It's not a cure for arthritis. It's not even a medicine for depression. What homeopathy is a way of keeping people's vitality and energy within normal range or their balance range. And so as a result of that, they can feel their best and pathology is less likely to develop, or if they're coming to me and they already have pathology, less likely to continue to further develop and worsen. So homeopathy works from the perspective of promoting health and vitality rather than actually fighting disease. That's step one, and that's the most important thing to understand for any perspective either homeopathic student or a prospective homeopathic patient. What I'm going to do over the upcoming weeks is just build on this and let you know a little bit more about what homeopathy is from a homeopathic perspective, and hopefully you'll enjoy it. Okay, that's it, and bye for now.